If your doctor refuses to answer a question that a 5-year-old knows the answer to, do they still have the right to give you medical advice? We have a serious problem in the House of Medicine, and it just keeps getting worse. Hi, Dr. Brian here, retired physician and founder of my functional health coaching program I call Health Without Risk. I walked away from the medical industrial complex in 2017 after 30 years of watching it deteriorate. I gave up my OB/GYN board certification in 2008 because I saw the politics coming. But what happened this week in a DC Senate hearing was the emperor wears no clothes moment for the entire profession. Watch this.
That men can get pregnant?
I hesitated there because I wasn't sure where the conversation was going or what the goal was. I mean, I do take care of patients with different identities. I take care of many women. I take care of people with different identities. And so that's where I paused. I think, I wasn't sure where you were going with that.
Well, the goal is just the truth. So can men get pregnant?
Again, the reason I paused there is I'm not really sure what the goal of the question
The goal is just to establish a biological reality. You just said a moment ago that science and evidence should control, not politics.
Absolutely.
So let's just test that proposition. Can men get pregnant?
I take care of people with many identities, but
Can men get pregnant?
I take care of many women that can get pregnant. I do take care of people that don't identify as women.
Can men get pregnant?
Again, as I'm saying,
Let me just remind you what you testified to a moment ago. Science and evidence should control, not politics. So can men get pregnant? You're a doctor,
agree.
I think.
Science and evidence should guide medicine.
Do science and evidence tell us that men can get pregnant? Biological men, can they get pregnant?
I also think yes, no.
It's not complex. I'm trying to get to an answer, and I'm trying to test, frankly, your veracity as a medical professional and as a scientist. Can men get pregnant?
I think you're also conflating
This is
male
extraordinary.
female with
No, I'm not conflating male and female. They're two different things. There's biological men and there's biological women. And I want to know, can men get pregnant?
What you were talking about is biological.
You're not going to answer my question, it sounds like to me.
Biological males.
This isn't hard, doctor. Can men get pregnant? Yes or no?
Again, I would be more than happy to have a conversation with you that is not coming from a place of trying to be polarized and
There's a difference between biological men and biological women. I don't know how we can take you seriously and your claims to be a person of science if you won't level with this on this basic issue. I thought we were past all of this, frankly. I can't believe we're still here talking about this.
I am a person of science, and I'm also someone here who's here to represent the complex experiences of my patients, and I don't think polarized language or questions serve that goal. I don't think they serve the American people.
It is not polarizing to say that there is a scientific difference between men and women, and I want this to be clear and for the record. It is not polarizing to say that women are a biological reality and should be treated and protected as such.
Did you see that? That wasn't a doctor speaking, that was the linguistic gymnastics of a politician. As a physician, you are trained to be a truth teller about the human body, but Dr. Verma chose a side. You think she was just being careful? No, she was being compliant. The American College of Obstetricians and Gynecologists Committee Opinion 823 literally scripts this. They've replaced the word mother with birthing person and breastfeeding with chest feeding. When a doctor uses this language, they aren't talking to you, they are signaling to their funders that they are safe for the next multi-million-dollar grant. In the modern medical industry, truth has a price tag. Organizations like hers have been fueled by tens of millions of dollars in federal grants and industry funding to push specific narratives. To say no to that question would be to say no to the funding. She isn't just treating patients, she's protecting a bottom line. Look, we saw these same shenanigans during the recent global health event. The same toe the line mentality, the same silencing of dissent. If a doctor can't or won't acknowledge the basic biological reality of who can carry a child, how can you trust their opinion on your hormones, your heart, or your overall health? The medical establishment has dug themselves into a ditch of distrust, and after this hearing, I'm not sure they can climb back out. They've traded their universal authority for tribal loyalty. It's time to stop looking for truth in the standard of care and start looking for it in common sense and functional reality. I'm focused on the latter. Are you ready to take your health back from physicians who have political agendas? What did you think of her answer or non-answer? Like and share this video, and remember to follow or subscribe to Health Without Risk, where we explore options for better health that don't involve politics. Health reimagined, risk removed. Thanks for watching. Bye.